November is American Diabetes Month, and the focus is on making healthy lifestyle changes to prevent the devastating disease. Jordan's standing by with an expert on how we can reduce the risk of type 2 diabetes.
Thank you, Tina. We are standing by with Dr. Fakori here from Kaiser Permanente. You are a physician there, and we're going to talk about diabetes and ways that we can actually prevent it. Over 30 million Americans are impacted by this disease. Doctor, thanks for being with us today.
Happy to be here. Thank you. Good morning.
Can you briefly talk to us about the difference between type 1 and type 2 diabetes? Because there's a big difference, right?
Sure. Type 1 diabetics are people who are born with a pancreas that's deficient in producing insulin. Type 2s are, they have insulin, but the pancreas may not have enough for the body to utilize to process sugar, or it's resistant to the insulin that the body is secreting.
Got it. So what are symptoms of diabetes or having that, especially type 2, and is it preventable?
Sure. The most common symptoms of diabetes are excessive thirst, frequency in urination. People may have blurred vision, as well as excessive hunger. You may have or experience sudden weight loss, and oftentimes you could have irritability.
Now, when it comes to preventing diabetes, it is preventable in some cases, right? And I know we talk about the biggest factor being exercise and eating healthy. Are those the best ways to really keep yourself healthy?
Sure. As you mentioned, there's 34 million people with diabetes, but there's also 88 million people with pre-diabetic who could potentially become diabetic within the next 5 years. So eating healthy is a major factor, as well as little as 20 to 30 minutes of exercise every day. But there are other measures people can take. If you're a smoker, probably make sure that you quit smoking and monitor your blood pressure. Make sure that your blood pressure is in good control. And if you're experiencing symptoms and you don't know what they are, I think contacting your healthcare provider is going to be key in treating it early and catching it before complications happen.
And when you go to the doctor to find out whether or not you have it or if you're pre-diabetic, is it all just blood tests and whatnot? And is that the time where you really start to focus in on trying to prevent it?
Yes, I think that annual well check with your doctor, it's a simple blood test. We don't even need to do fasting blood tests anymore. You could do what is called an A1C, which is a 3 months average of sugar that could determine whether you're pre-diabetic or diabetic or even at risk for developing it.
Now, I guess when we talk about, our community as a whole, are certain ethnic, races or backgrounds more prone to developing diabetes?
Absolutely. I think Latinos are at very high risk. African Americans and blacks are at high risk. The Asian community at high risk. And a lot of that is derived from genetics and hereditary, but also dietary, high carbs and not enough exercise.
So interesting enough, you say, the food about it, because a lot of, when you talk about those ethnic backgrounds, culturally, we enjoy certain types of foods. What would be your ideal type of meal then, or a balanced meal for someone who is, trying to prevent getting diabetes?
I think as a diabetic, it's a balance. I mean, you have to have some carbs. Just make sure they're healthy carbs, not refined sugars. Whole grain is usually better than white. Make sure you have enough greens and vegetables and some protein, whether you eat meat or poultry or vegetarian. I think that protein should be a staple also with the diet of diabetics.
Awesome. Well, Dr. Fakori, thank you so much for just enlightening us about National Diabetes Month and about ways to really prevent this disease here. We thank you so much for being with us today. I appreciate that.